the only reason that we're surviving like this right now is because of the social distancing and the ability for everybody to separate and sort of slow the spread of this virus.
This is Startup Health TV with a special COVID-19 health innovation update. I'm joined today by Howard Krein, the Chief Medical Officer here at Startup Health. I'm Logan Plaster, editor of Startup Health Magazine. And Howard, we're making this a weekly thing because during COVID-19, things are changing fast and we need to get our Chief Medical Officer's advice on at least a weekly basis. So thanks for joining me.
Absolutely. So happy to be here.
So tell me, we spoke 7 days ago, and it feels like things change on the hourly, if not every 4 hours. Tell me what's transpired there in Philadelphia, where you practice, in the last 6 or 7 days.
Yeah, well, you couldn't be more right. It's amazing. We spoke last week, but if you stop and just think about what's happened in the world and how everything has changed, if just really literally within the month, the last 3 weeks, it's been remarkably fast with every day new information and new recommendations. So in Philadelphia, what I can tell you is we're holding strong. I practice at Jefferson University Hospital. It's one of the hospital systems right downtown Center City. We have a reach far around the tri-state area. We've been fortunate. We have not gotten hit to the extent that some cities, especially New York, and some of these other cities have. And I can tell you, I think that the only reason that we're surviving like this right now is because of the social distancing and the ability for everybody to separate and sort of slow the spread of this virus.
Yeah, you bring up an interesting point. Philly has a close proximity to New York City. I mean, do you see this as a sort of matter of time, given that proximity, or do you really feel like Philly caught it earlier?
Well, I think that, so New York and New Jersey are two of the hardest. Obviously, New York, there's nobody that compares to New York. They're 10, 15 times the infection rate of anybody else in the country. But I think that it's eventually going to get here. Now, hopefully we've flattened the curve enough that it doesn't decimate our healthcare systems the way it is in New York.
How have you seen the? And I hear you've got a friend in the background there.
Can you hear her?
Yeah,
she's protecting the house. You don't know what's going on outside, but if you have a dog, you're going to be safe.
Yeah, I've heard a few more dogs barking during interviews on NPR in the last few days, as everyone dials in.
Everybody's doing the right thing. They're actually. It's funny thing is, I saw it on CNN. One of the hosts, they must have set some little studios up in everybody's house. As a matter of fact, I know Vice President Biden has a studio in his basement too. And same thing. You hear dogs barking, sometimes kids in the background.
Yeah.
But it's the way of the times.
It is, and it's kind of our show of solidarity. We talked a bit about telemedicine last week, and I'm wondering, have you seen the uptick in that? Any changes in how people are responding to it?
No. So what I can tell you is last week, just using my office as an example, we made the commitment to try to move to telemedicine even before we actually had the recommendation of becoming a patientless office. We decided that we wanted to try to make our practice a completely COVID negative practice. We wanted to try to limit the office infections to zero. So in the spirit of that, we went completely telemedicine. Now we have a few patients coming in. Our office is a 2-floor office. We've actually made the top floor completely patient-free. The bottom floor, we're on 6th and 7th floor of a building. The 6th floor will house any patients that need to come in. In spite of trying to do social distancing, there are still people that need care.
Yeah.
We want to make sure that as we lock down and try to decrease the spread of this virus, that we don't forego people who need medical care. And there's a whole host of people that are in the middle of very bad problems, whether it be cancer, whether it be traumas. There are people that still need care, and we still have to be able to make sure that we can help these people.
So what's your practical advice to somebody who's experiencing an episode of some kind that would normally be a simple answer, go to the ER, but they're anxious, they're scared? I mean, what do you tell them?
Yeah, I think that every situation is different, but if there is a true emergency, if somebody is, and for what we deal with, is shortness of breath, epistaxis, we get nosebleed, something bad, chest pain, you still need to go to the ER. If you think it's something that might be able to wait, then the recommendation is you contact your physician immediately, discuss it with them, and use the guidance of your provider to know, should I go to the ER? Is this something that can wait? But what we're telling people, if you think that you need to go to the ER, if you're having symptoms of stroke, bless you.
I'm trying to model good coughing.
There you go. That was good coughing, actually. But if you have any question and you think that you need emergency help, you need to go to the ER. The ERs are still open, albeit they're being overworked, but they're still open. The physicians, the providers, the nurses, we are still there for patients, regardless of what they need.
Have you had any recent conversations with the emergency physicians there at Jefferson? Do you get a sense of what they're dealing with?
Yeah, well, again, so far we've been very fortunate at Jefferson that we've really have a limited number of COVID positive patients. So we are ramped up. As a matter of fact, we just started our 4-hour testing. So I believe this morning was the first cohort. We did about 144 tests this morning. They're going to do it by twice a day. So I think the second set is coming out at 5 o'clock, and they're going to do another probably 200 tests. I think we could do about 400 a day. But that's the biggest thing, is now that we're getting the ability to identify who's positive, who's negative. I think the big next step is going to be able to, when we're able to do antibody testing, and hopefully be able to determine who's already had it and who might be immune. You're muted.
I thought something that would be nice for the two of us to do, since we're going to make this a regular thing, is to talk about some of the stories that Startup Health has been putting out. And just this morning, I'm going to share my screen so you can take a look at it. We put out a piece called Quarantine Tech about the remote monitoring tools that could prevent escalations in COVID-19. And we highlighted a couple, which I think are interesting to discuss, partly because they really are on the leading edge. This isn't being used yet. So this is really sort of forward leaning. One of them being Oxytone, a pulse ox watch, really kind of a comfortable way to do a continuous pulse ox day and night. And then the other one being this Mouth Lab by Adar Health that sort of acts like a breathalyzer. You just breathe into it for a few seconds, 30 seconds, and you get a whole host of vitals, including lung function, breathing patterns, and then pulse ox, blood pressure, everything. So, what are your thoughts about at-risk populations having, more in general, having better ways of monitoring their vitals from home? Is that just asking for trouble? Is that asking for more worried patients, or what?
Yeah. Well, first off, Logan, let me just tell you, I love reading I love the articles. This is a fantastic article, and it really does hit home to what to the kind of environment that we're living in now. Never before in the history of the world would we be able to do what we're doing currently, and that is move an entire medical system into a virtual or digital health medical system. And you hit it on the nose with this article. Companies like Oxytone and Mouth Lab are really going to be the future of medicine. Both of these are fantastic companies. They've been at it for a while. But the ability for a physician to remotely monitor and gain important data from patients without having them be in your office is invaluable. It's going to allow us to continue to develop and improve on digital health technologies and a patientless office, if you will. And so this goes beyond just the COVID-19 issue of how do we get through this pandemic, but it really is about how do we continue to take care of each other in the face of whatever it is, even somebody who is bound at home because of travel restrictions, because of inability of mobility, because they don't have anybody else around to take care of them or take them into a doctor's. They're not going to be lost in the fray. They're going to be able to get the same kind of health care that somebody who can get to a doctor. And I think it's going to also drive down the cost of healthcare.
Sure, sure. Obviously, remote monitoring, at-home monitoring has been around a long time. I mentioned in the article, just this is a market that has been in existence for decades, and yet now we're seeing new applications to maybe a population health scenario or a pandemic scenario. I wonder, my sense is it's been pretty slow to get picked up by consumers. This idea of like gathering my data on a regular basis, not just a Fitbit, but hospital grade data, and getting it into my doctor's hands in enough of a continuous way that this can feed my sort of my health journey.
Yeah.
Why do you think it's been so slow, the uptake on that?
Yeah, you know what? We talk about this at Startup Health. It's the one hit wonder kind of thing where you're like, hey, never heard this song, this fantastic song. Can't believe they just came out with it. And you found out that band's been together for 15 years, putting out music and stuff. Listen, I think digital health technologies is been around for a long time. Startup, we've been around for 7 going on 8 years. Really sort of talking about the need and what digital health can do. Technology and the acceptance of this technology is really just starting now, and I think that you hit it on the nose with Fitbit. I think that Fitbit really sort of started getting people used to, hey, I'm wearing a data collection device, and making it acceptable. Apple has then sort of moved that, and we all wear Apple watches and don't think anything of the fact that it's taking our heart rate and watching our sleeping patterns and stuff like that. And as a matter of fact, we're now accepting it. I think that next move, which you're right, is how do you go from a society where we're using it for entertainment and for basic health to really using it for accurate medical treatment. And I think that what's happening is that we're at a time when whether it's the FDA, the doctors, and the patients are now finally accepting the fact that, yes, the information that these devices are collecting are actually credible amounts of data that are medical grade. And I think that's the biggest key, is we want to make sure that we're keeping people healthy, and that we're not selling them a snake oil of saying like, oh, you're going to wear this and we're going to. What we want to make sure is that it really is the accurate data, reproducible data, and medical grade data that we can really base evaluation and then treatments on.
I mean, you're a practicing surgeon. How would it change your practice in practical ways to really have continuous data on your patients flowing into the record, and more than that, giving you predictive analysis, telling you when you should pay attention to something ahead of time?
Yeah, well, let me tell you, I can talk about my practice, but even more importantly is during this pandemic time, even if you stop and you just talk about a company like Oxytone, which you were talking about, which you mentioned, which is the continuous pulse oximeter. Imagine if everybody who was suspected to have COVID-19 was able to have a pulse oximeter, an Oxytone watch at home, and where you'd be able to go home, and during your entire course of this illness, your doctor was able to monitor your pulse oximetry, indicating if you're starting to get short of breath or you're starting to desat, indicating that your disease is getting worse, and then bring you into the hospital, versus saying, you know what, everybody, you're positive, we have to bring you into the hospital. So it's going to allow the entire medical system to sort of adjust once we get this kind of technology out there and it's ubiquitous, to adjust to really bring the people into the hospital and deal with the people who really need it.
Yeah.
Same thing is with anything, with mouth lab or anything, being able to stratify the patients who need care from the patients who are doing fine at home is going to be invaluable.
You mentioned the concern of, selling snake oil, and at a time like this, it's certainly problematic. You see a lot of people on Twitter and on social media, putting ideas out that have no basis.
Yeah.
As a physician, are you concerned about that? Have you seen that crop up? Are there particular myths that you're concerned about?
Listen, there are. I think that during times like this, everybody is trying to gather as much information and data as they can. I think it's really so incredibly important that our leaders are putting out credible data, that they're not overselling or underselling things. I think that we as a society, we need accurate data, honest data, so we can all understand what's going on and make the best decisions for ourselves and our families and our loved ones. I think it is tremendously dangerous. And I think that, listen, you saw it with Plaquenil and the azithromycin treatment and what went on. Literally, we got this sort of push like, hey, yeah, maybe it would be something. And then some people said, oh, this is going to be the magic cure. And you had this huge flux of patients and physicians and everybody going and trying to fill prescriptions that actually can hurt people. And I know that there's been one or two stories of people who tried to take some of these medicines and actually died. You have to take everything with a grain of salt unless you hear it from credible places. And then even when you hear it from credible places, you have to sometimes go, hold on, let me just make sure and make sure that multiple credible places are dealing with this. I always tell people, make sure you run anything by your provider, your physician, people who know you, because everybody's situation is a little different.
Yeah, this is one time when I like working with, or at least speaking with practicing physicians, because in my previous work, I edited a medical journal, and I feel like nothing could get published without scrutinizing the confidence interval and the meta-analyses behind it. And everything was, well, let's just check on that one more time, and let's double check that is actually good enough for print.
I think that we in medicine always say, listen, you have to be careful of what you tell people, what claims you make, because it really does. It affects people's lives. And it's a life and death situation. We don't say things lightly in medicine. And certainly at a time with this pandemic, nobody should be saying anything without truly understanding it, and without the experts really understanding it and agreeing with that. And without that validation, it just, you have to be careful what you share.
Do you feel like in your community, in your circles of people that you interact with, do you feel that generally individuals are overestimating or underestimating the dangers of COVID-19?
Well, I think, and I'm trying to remember who I said it. Somebody said it on online or on TV the other day, is you cannot overestimate this. You can only underestimate this. I mean, if we overestimate it, what are we gonna say? Like, oh, you know what? Maybe we shouldn't have been shut down for a month. Maybe we could have done it in 3 weeks. But the truth is, we've saved lives. And listen, we have to balance everything out. The economy, and everybody's talking about all different things. But the truth is, we don't understand this or know this yet. We don't know what's going to happen when we start easing the restrictions.
Hmm.
We really have to sort of pay attention to the data that's coming from the countries that are ahead of us, whether it's China or Italy, to see what happens when they lax their restrictions. Is there going to be a second spike? Is it
Sure.
that you're seeing that we flatten the curve and then all of a sudden we bring people back into the workforce and then we see a second spike which devastates people? We don't know. So I think that we have to take it very slowly. We have to really crunch the data. We have to learn from the people that have gone before us. And the truth is, that's what we do in medicine.
Yeah. Well, I think that's a good note to end on. Any final doctor's advice, Dr. Krein, for our viewers?
I would say continue with the social distancing, stay healthy, come up with new and novel ways of connecting. Just because we're socially distant doesn't mean we have to be emotionally distant. I think I shared with you, it was my mother's 80th birthday last night, and we had a Zoom birthday party. We did a video birthday party.
Happy birthday.
They're down in Florida. My brother's, at his house. My sister's at her house. Everybody got together and we did a big 2-hour birthday, and it was fantastic. So socially distant, but emotionally together.
That's awesome. All right. Well, thanks to our viewers for joining us for another COVID-19 Health Innovation Update. Dr. Krein, thank you for your time as always.
Look forward to talking again. Logan, stay safe.
All right. Take care.
All right. Take care. Bye-bye.